Okay. Hi, Professor Anderson. My name is Matthew Matos, and this is my son Mitchell. He's going to be my patient today. And this is my head, ears, eyes, nose, throat video. Okay, and Mitch is going to be my patient today. And Mitch, I need you to say that you consent to recording.
I consent to recording.
Okay, perfect. So we're just going to go on the scenario that Mitch and I have never met, and he is a new patient of mine, and I'm going to be assessing him, and we're just gonna roll through it. First on scene, Mitchell. He is a 22-year-old male. I can tell that he is very healthy. Excuse me. He's very healthy. He's in shape. He's very muscular. He works out, obviously. Upon speaking with him, he is very alert and oriented. His speech is very appropriate, and he maintains eye contact, and very healthy individual. So to start the assessment, I am just gonna take a look at his head. And what I'm doing is just kind of take a look at his head, see if there's any abnormalities. I'm taking a look at his skin. I'm looking for any dryness, just any type of abnormalities. I'm gonna feel his scalp and his skull. I'm looking for maybe some cysts or lesions or anything like that. That is out of the abnormal, no, everything looks good. So what I'll do now is head into the eyes, and I'm gonna take your glasses off.
Okay.
Looking at Mitchell's eyes, where I am inspecting his orbital area. I'm looking at the skin around the eyes. I am assessing for any edema, any bruising, any swelling, anything like that, and everything looks good. I am also looking at his eyebrows and his eyelashes and his eyelids, and his tear ducts, and everything looks healthy. Everything is hydrated. There's no dry spots. Everything looks healthy. There is no drooping of any particular side. It all looks symmetrical, and yeah, his eye orbital area looks healthy. I'm looking at his sclera, and his eyes are whites. There's no browns or bloodshots or anything like that. One thing I'm going to do is test his his vision acuity, and to do that we would use the Snellen chart. But being that I don't have one here, typically in an office, I would have Mitch cover one eye and look at the Snellen chart, which is a list of letters from across the room, and he would read me the best line that he can on that chart, and we would alternate eyes on that. The next thing I would do is to test his field of vision, and with that I'm gonna do the confrontation assessment. So with Mitch, with this confrontation assessment, I'm going to have you cover one eye, and we're going to test his peripheral vision. So I'm going to hold, I want you to tell me how many fingers I have over here.
2.
Okay, and right
1.
here.
1. 2.
Okay, and that's kind of used to test his peripheral vision, and we would do the same with the other eye, but for the sake of time, we're not going to do that, okay? The other vision test we'll do is the 6 fields of gaze. So Mitch, I want you to keep your eyes straight and keep your eyes on my finger. And I'm going to move. I'm going to move my finger up here. Move it back down. Move it over here. Okay, down, up there, and then off to the side, and off to the other side. Okay, perfect. And we're doing that to test the ocular muscles, and all his ocular muscles look good. They operated smooth, and no jumps at all. The next thing we're going to do is the perla, and to do that I will need my ophthalmoscope, and so with the perla we are testing we're looking at the pupils, and we're testing that they are equal and they are round and they are reactive and they are reactive to the light and accommodation. Okay, and the last thing I will be doing, and I need to set my ophthalmoscope to 0, is the red reflex. And what I'm going to do is shine this in your eye.
All right.
And okay, and by doing that, I can get a good look at the optic disc. Okay, so I think that concludes the eyes, and the next thing we are going to move on to is the ears. Now again, I am doing my inspection. I am looking at Mitchell's ears. I'm palpating these. I'm just feeling for anything abnormal, any nods, any bumps, unusual bumps, any cysts or anything that feels abnormal there. And I'm feeling the traguses, and I'm feeling the auricles, and I'm feeling the mandolins as well. Okay. Next thing I'm going to do is take my otoscope and check into the tympanic membrane. And to this, I'm pulling down his ear a little bit and taking a look in there. I am taking a look and making sure that there's no fluid, that there's no infection. I'm taking a look at the cone of I want to say the cone of light, and make sure that line is at about a 5 o'clock position. Okay. Then let's see here. What else am I doing with the ears? Yeah, I'm just making sure that his canal is pink and just no fluid and no sign of infection. Okay. What I'm also going to be doing is giving him a series of tests. One test that we do is the finger rub test. So Mitch, I'll have you close this ear, and then I'm going to take my finger and rub these together on this other ear. Can you hear that?
Yes.
Okay, and I would do that with the other ear as well. The other two tests, the Webster test and the Raines test, I need with a tuning fork, but I don't have that today. But I'll explain how we do that. With the Webster test, I would flick the tune fork and get that to resonate, And then I would place it on Mitchell's head right here. And then I would ask him, where do you hear, or where do you feel or hear that vibration? And his answer should be right in the middle. Sometimes if there's a ear or a hearing deficiency, it can be swayed to one side. The other test that we do with the tuning fork is the Rains test, and that's, again, we're flicking that, and with that I'm placing it back here against his skull, and again we're asking him and I'm also putting it near his ear, the entrance of his ear, to see if he can feel and hear both of those scenarios. Yes, and I'm just making sure that I don't miss anything on the ears. Yeah, okay, I think we're good to move along. I think the next piece is the mouth. With the mouth, it's just basically an inspection. So what we're going to do, I'm going to have you open up wide. Typically, I would have a tongue depressor and just kind of move around there, move some, allow me to get a better look. But with my otoscope, I can look, and what I'm looking for is any lesions, any scrapes, any cuts, any sign of infections. What the areas that I'm looking at in here is the mucosa, which is the side of the cheeks and the inner of the lips. Where I'm looking at the teeth, I'm looking at the gums, I'm looking at the tongue. I am looking back at the uvula and his tonsils. I'm assessing I'm assessing his lips to see if there's any hydration on those, and just make sure that those look good and healthy. I am looking at the mouth floor under the tongue and looking at his mouth roof and the upper and lower palate. Yeah. Okay, and that looks good. The next piece we're going to move to is the nose. Again, we're going to take a look at the nose, see if there's anything that that needs to be addressed. We're looking at any growths, looking for any growths, maybe there's any type of issues with the skin, maybe any warts, anything like that could pose as a problem. I'm going to check his nostrils for patency. I would close one nostril and just have him breathe through that nostril, check and see if there's any resistance, any restriction. Make sure there's no wheezing or anything like that, and do that with both nostrils. I also look at his septum, make sure it's not deviated. Okay, I'm looking inside the nostril, looking to see make sure they're healthy, make sure they're hydrated, make sure there's no scabs. Let's see here. Yeah. Oh, and then I'm also, come on down. And I'm also going to be looking at the sinuses, the upper sinuses and the lower sinuses, checking for tenderness, checking for inflammation, any pain of anything like that. Oh, and then I'm also looking, while I'm in the nostril, I'm also looking at this outer ridge, the tubercles. Make sure that those are good and healthy. Okay. Okay. Now I'm going to move down the face into the neck, And really with the neck, I'm just looking for some symmetry, make sure everything's equal. I'm looking for make sure there's any bumps, just making sure everything's equal and symmetrical. I'm gonna have you do a range of motion for me. Let's do some up down, side to side, and maybe go do a circular. There you go, there you go. And then I'm gonna, next thing I'm gonna do is assess his thyroid. So typically for his thyroid, I would come in from behind and palpate around here on his neck area. And again, with the thyroid, I am looking for nodules. I'm looking for tenderness. I'm looking for any type of pain. I'm looking for any type of growths, things like that. And Mitch, can I have you look up and do a cough for me? Okay. Okay, good. And then I'm looking at his trachea. And again, I'm starting down here at the base of the neck. I'm just kind of feeling up and just inspecting it. I'm looking for alignment. I'm looking for alignment on his neck as well. I'm looking for alignment on his trachea. Yeah. Oh, and then with his trachea assessment, I'm gonna feel his carotid carotid arteries. I'm gonna feel for pulses there on each one at a time, and just make sure that they're strong and good and good. The let me think here. I'm just making sure. I'm just reviewing my mind, just making sure I'm not missing anything. The last thing that I am going to assess is for lymph nodes. With the lymph nodes, we are looking for any type of swelling, and I know some of these are hard to feel, but we're looking for anything that's going to stick out to us, any type of swelling, and or tenderness or anything like that. So go ahead and look down, look about like that. So this is the pre-auricle area, and then the post-auricle area, and then I'm going to move down to the occipital, and then move in front to the tonsillary area. Again, everything is feeling good. And then I'm going to move under to the submandibular area, and then move up a little bit in front to the submental area. And then I'm going to feel down here, kind of near the carotid areas, right around this neck, main neck muscle here. I'm looking for the front, the deep cervical lymph nodes, and then in the back, the posterior cervical lymph nodes. Then the last spot for the lymph nodes is down by the clavicular bone. Sorry, and I'm looking at this supraclavicular lymph nodes right there, right above the bone there. Okay, and I think that is about it. Mitch, thank you for being my patient.
Yep.
I'm going to do one last mind review, make sure I'm not missing anything. I don't think I am. But, yeah, okay. Thank you very much. I appreciate it.